best thing about being a GP. You just don't know when you're going to see something that's quite rare, quite interesting, and when there may be something quite serious coming in.
We need to get you seen by the hospital specialist. We need to make sure we're not missing anything.
Baby Frankie is having a heart operation because he has a hole connecting the left and right sides of his heart.
We have oxygen for him at home.
Yeah?
He's been in hospital for the last, 2-3 weeks.
The best thing about being a GP is the ability to help people and what you get back from patients. How did it happen?
I pulled the door shut right on my leg.
Oh, I see.
Slammed it.
Oh, my.
I'm in agony, I tell you. I've got all that hair. Every time I was trying to get some sleep, my back was popping like bubble wrap.
(9) it should have been.
So this is 10:50, that's 10 to 11.
Is that here?
I think so.
Gloria Wright, please. Hi, morning. Come and have a seat.
Thank you.
Right, how can I help?
I've seen David Ward about this.
Right.
And he gave me some steroid cream, but it's done absolutely nothing. It's me ear.
Okay.
It's sort of bubbly, but it's really sore.
Okay.
And it keeps waking me up. Because I normally sleep this side, but when I turn over, I don't know.
Right.
And I just want to get rid of it.
Okay. How long have you suffered with this?
It's been about 2 months.
Okay. Let's try and see if I can help you for this. So there is a sort of a dry area, and that's tender, is it? When I touched it. Okay. And then is this tender at all? This bit here? No. Okay. Just check behind your ear.
It's literally just that little bit at the top.
You can get these sort of hard, because you've only got cartilage, very, very thin skin in that area of the body. Can I compare to the other ear?
You can. Let me get my hair out of the way.
So you can get sort of this development of these sort of horns sometimes.
Don't say that. People already think I'm a witch.
No. Okay, so what you had was a weak steroid. Do you remember I gave you something called Elocon in the past?
Yeah.
Did you apply any of that on there?
No.
Okay. It's not definitely going to say it would make it disappear, that sort of hard area of skin, but I want to see if it makes a difference. I'm hoping that this is more an inflammation of the skin sort of at this stage. I think it was suggested it could be a wart, like a seborrheic keratosis, but you can get this something called chondrodermatitis. It's a long name, nodularis helicus, where you get this sort of dry, hard bit of skin. In extreme cases, they can cut them out and do things, but we'll try the Elocon once a day. So there's some information there. That's useful, actually, printed out.
Lovely.
All right?
Great.
So if you're not happy, come back and then we'll meet again.
Brilliant.
Yeah? Nice to see you.
Thank you.
Take care.
Have a good day.
Thank you. Bye.
How can I help today?
Basically, came for a GP appointment with Dr. Matthew. What happened was, so came in, obviously, found, spots of blood in my urine. And then, she referred me to the urologist, and there was a tumour. I had a tumour in my bladder. I think it's cancer and everything. But,
And
I had it
where
taken out.
You've had it taken out?
Yeah, I had it out on Friday.
And when are you seeing them next in terms of getting the results of the biopsy and things?
18th of this month.
18th, okay. And is the blood basically resolved now, or?
Blood, well, no, even that hasn't, but that's more because, I've had a...
You had a camera in
a
procedure.
The thing out, so...
Fine. And you've been off work, is that right? for this.
Yeah.
Yeah. How long have you had off work for this so far?
Well, I had a couple of days off holiday anyway, so I've only actually taken Friday off sick.
Mm.
So
And
it's just where I've got like an active job. I feel all right, but
are you planning to take more time off? Are you going back to work? What are your plans?
if it was like a office job, I'd probably go back next week. But where I'm an electrician, like, I don't know.
It's a bit more physical.
Yeah.
Yeah.
I just don't want to like I feel all right, but I don't know.
Should we sign you off for a week?
Yeah, sure.
And then go back and...
Yeah.
I mean, obviously, any further treatment depend on the results, really, of what was taken out. All right, we'll see how it goes on the 18th. Take it from there, really. Yeah.
All right.
It's unusual finding in a 30-year-old, I must say.
Really?
Yeah. I'm sure they've told you that in the hospital as well.
Yeah, I know.
So, it might be benign. We don't know that, really.
So, yeah, hopefully it isn't. But the thing I'm not looking forward to is like every 3 months having a cystoscopy. Like, it's absolutely filling me with dread, but it's got to be done, isn't it?
All right, you take care of yourself. All right.
Thank you.
Hello, Terence.
Hello, Dominic. Can somebody sort something out about your toilet?
What's wrong with it, my love? We don't even get a chance to go in there.
No, it pinched my bum. With all the money they're going through here, you could at least afford a new toilet seat. I'll buy it. My toilet seat's broken.
Right, we'll put a note.
Pinched my bum.
We'll report it.
I'll report it for you.
After we've all sat on
I've
it.
known my bum pinched for years.
Hi, come on in. I think I've met Frankie before. I think I came home to see him once.
Everyone's met him.
Yeah.
Everyone.
He's Mr. Popular.
So, he's been quite sleepy at home, sleeping quite a lot.
Okay.
He hasn't done any poo in the last couple of days.
Okay.
And we have oxygen for him at home.
Yeah.
He's been in hospital for the last 2-3 weeks. With his mum.
Frankie's suffering from a genetic disorder called chromosome 3p deletion syndrome, which is a very rare genetic problem. Genes are the bits of code that make us who we are and tell our body how to grow and develop. And unfortunately, in Frankie's case, he's missing some of this code, which can lead to some problems in the way that the body functions.
Yeah. And it's christening on Saturday, so we just want to make sure things are nice.
Yeah.
So we don't miss it.
Of course, yeah.
He's supposed to be having his open heart surgery next week.
Right, okay. Okay, so a lot of important things coming up.
Yeah, but I'm not sure if that's going to go ahead because Great Ormond Street said they haven't had the pre-op assessment. I think people haven't spoken properly and it's been sort of
I guess it's quite a complicated case, isn't it? So there's lots of people who need to speak before this sort of thing happens. Okay. Baby Frankie is having a heart operation because he has a hole connecting the left and right sides of his heart. He also has a narrowing of one of the arteries that leaves the heart, and so this needs to be surgically repaired.
I believe she's got a urine infection or something. Looked at the symptoms online, Dr. Google. Yes.
Have any problems when you're passing urine?
No, but it's just stinky.
Right, okay.
Can you go and do a urine sample for me?
I can try,
When was the last time you opened your bowels?
Because when she wheezes, she cries, and she was like holding this area here.
Very lucky that the loo is just opposite. Okay. Okay. See you in a second.
Right, so we're going to do your diabetic bloods?
That's correct.
Yeah. Did you bring a urine sample with you?
Well, can I tell you something now?
Go on.
I was about 2 or 3 weeks, or 2 or 3 say appointments ago.
Yeah.
I brought my urine sample, and I was told you don't need that. Oh, why don't we need that? Well, we don't do it anymore. Now,
I think it's a case of the blood work. We grab everything from the blood work, and obviously we do use the urine to check the glucose in the urine as well. I think the urine is more sort of old practice.
Correct.
But it's still a practice we would like to do. So.
Well, I'm damned.
Yeah, essentially. I mean, it's always good to have the urine sample.
Well, yeah, I would agree with that.
Yeah, I would like a urine sample if you could do one for me.
Okay, I'll
and
give it a
you
go.
a ball, yeah.
Well,
Do you want to go after and we'll do the bloods first? And,
Well, you
yeah?
can do. I don't mind. But you've got to be doing something, haven't you?
Right, OK, let's grab a pillow. Pop your arm on something.
You assumed I was going to give you my left arm.
Maybe. Closest to us, but there you go. I saw this big bulgy vein and I thought that's what I'm going for.
You don't just sink your teeth into it, eh?
No.
No, all right. Do I get a sweetie after this?
Yeah, and a bag. I got a badge as well, sharp scratch. Little sticker. So, if I give you a bottle, maybe you might need to run the tap, who knows?
Where's the toilet? Out there or somewhere?
Yeah,
is it?
just go past the waiting room and it's just there on your left.
Oh, right.
Big handle. All right?
That's all right, mate. I mean, I remember compared to what he was like when I last saw him at home a few months ago, he was really struggling with the breathing and it was like really rapid. But the breathing seems a bit more settled compared to the last time I saw him.
That's good. That's what I want to hear.
Chromosome 3p deletion syndrome is rare in itself, but Frankie actually has a particular type of deletion called 3p25, which, if you look at the literature, only 50 cases have been reported since the first case was found in 1978. The most common problems include difficulties with breathing, which we saw that Frankie had, but also some structural problems with the way that the heart forms. There are also difficulties with feeding and gaining weight, and later on in life there can also be difficulties with learning and behavioural problems as well. Like I mentioned, I mean, compared to the last time I saw Frankie, his breathing actually isn't that bad.
Yeah.
I think he does tend to sort of suck in a bit from what I recall of seeing him, and that seems to be his normal. But actually, at the moment, his temperature's down, and actually, in terms of his symptoms, I think actually he's doing all right.
That's good.
Obviously, if at any point he does develop a fever, or you're worried that his breathing is worsened, then obviously we can see him as an emergency. Or you can, ring 111 if it's out of hours. Okay. The long-term prognosis, it will be a challenging course for Frankie, undoubtedly, but he's got specialist input and he'll have the right sort of care right the way through his development to ensure that he is able to live as fulfilling life as possible.
Thank you very much.
Yeah?
Good man. Does that sound good to you? Yeah?
Yeah.
Yeah, tell your mum. Ooh.
Okay.
Cheers, mate. Thank you.
All right, take care.
You too. Bye-bye.
Bye-bye.
The doctor's told me I need an appointment in 2 days' time.
Oh, you'd have to call on the day.
Everything's coming out.
What are you doing? You could have got it from the front. And then you can put it back at the front.
Mr. Victor Dell? Hiya. Have a seat.
I'm out of work a bit quick, so sorry I'm a bit dirty.
No, that's okay. That's no problem at all, sir. I'll just introduce myself. My name's Vijay. I'm one of the clinical pharmacists of the practice. I've just brought you up. So you're here for a medicines review, sir?
Am I? Okay. That's what you say.
Okay. So you take a few different medicines for different things. Diabetes, blood pressure, cholesterol. Is that correct?
You say so?
Yeah. I think, yes, some of your medicines have expired, so that's probably why you're here for review as well. In terms of your medicines, how have you been with those? Are you taking them regularly, sir?
Yeah, every day.
Yeah, okay, brilliant. Now, diet-wise, are you conscious about what you have, or...?
Don't tell me to lose weight, because it's not happening. Tell you that now.
Okay.
I don't eat that great. I eat fish, chicken, diet drinks if I have any. Trouble is, I can't exercise. I've got nerve damage in both my legs, which I go to the hospital quite often to have epidural jabs with steroids in and that.
Okay.
I just can't swim, I can't ride my bike now, I can't go out for long walks.
Okay.
Can't do sit-ups, nothing like that, so...
All right, so that you can't restricted with that.
It all depends what goes in my mouth.
Yes. Do you have alcohol, sir?
Yeah.
How many?
As much as I can get down my neck.
Do you smoke?
I do, but I've got onto the vape, and I'm down to about 3 now.
Okay, so you're looking to
So
cut down.
Yeah,
and-
I'm trying to stop completely.
So we need to kind of look at how we can bring this blood sugar down, try and stick to fiber and stuff. It's more filling, it's more healthy, saturated fats. From a tablet's point of view, gliclazide, we could probably look at adjusting the dose to see if we can bring the blood sugar down. After that, we would probably have to consider insulin at some stage. I don't know what your thoughts on that is.
No, I'd rather go without that.
Yeah, yeah, no, it's...
It ain't going to happen. I only live once. If I'm going to die next week, I'll die. Don't worry about it.
That's fine.
Definitely.
Okay.
I've got to be on death's door to take that, and I might only be here for another 5 years anyway. I'll be in my box by then.
Okay, not to worry. I'm sure you live much longer than that.
I very much doubt it. You don't live with my wife.
Okay.
There are 2 people who are due to arrive from the 2:15. We're just going out to visit and I should be back.
Okay, John, that's waiting room for you.
Or in the boardroom if it's empty by that time.
Dwayne Fernandez. Come in. How can I help?
Give me 1 second. Doctor, as you know, I'm diagnosed with Crohn's disease.
Yes.
Okay. I used to see Dr. Diore regularly. She wasn't available today, so I've come just to see herself today. I had 5 periods of loose bowel movement over the 2 days yesterday. Yesterday was 5 a.m. and 5 p.m.
Yeah.
And today was all in the morning, 3 a.m., 5:30 and 8:30 in the morning.
Mm-hmm.
A bit concerned, obviously, because that has just come about now.
Yeah.
I'm on steroid medication, and that's prednisolone after being discharged from hospital. I've got letters here.
Crohn's disease is, in essence, an inflammation of the bowel. It presents generally as diarrhea, and sometimes blood in the stool, a bit of weight loss, abdominal pain. It's a difficult condition because there isn't actually a cure. I think we're betwixt and between here. Do you understand what I mean? We're waiting for starting the new medication called Humira.
Humira, H-U-M-I-R-A.
Yeah. And I think that's good news because it sounds like your Crohn's is not properly controlled at the moment.
No.
We need to wait, okay, until you start this. When patients are under the care of specialist teams, if they come to see the GP in the middle of this, it can actually be quite difficult. You want to give the specialist team free rein to manage. That's why they've been referred in the first place. And so there can be some difficulties when managing patients in those circumstances of shared care. The problem with Crohn's is when it's not behaving itself, it can be very difficult for patients. And I think we need to wait until it's...
Wait for the blood test results and then see how that's
going. I would wait, yes.
All right, sir.
Okay. Any worries, come back and see us.
All right. Okay.
Okay.
Thank you very much, Doctor.
Cheers. Take it easy.
Doctor.
Bye-bye.
All right.
Bye-bye.
Have a nice day.
Bye-bye.
Come in, grab a seat, Mr. Hiles. I've got a student with me today, if that's all right. Grab a seat. Right, what can we do for you then?
My knee is getting worse, my osteoarthritis.
Uh-huh.
The painkillers I'm on, it just ain't doing nothing. I can't work or nothing anymore.
What do you do for a living?
Bricklayer.
Right, OK. So you need to sort of use yours. Is one knee worse than the other?
Yeah, it's only in the left one.
It's only in that one?
Yeah.
Did you injure that one in the past or anything? No. OK. And
you know when you get a toothache and nagging.
Yeah.
It's like that constantly.
If 10 is 10 the worst pain you can imagine, and no, it's no pain. Where does it lie between those two?
Well, I'd say 9.
9.
Yeah.
And when does it get worse then?
It gets worse when I bend my knee.
Yeah.
When I'm upright, it's fine.
Okay. When you're walking, is it okay?
Ain't too bad, yeah.
Yeah.
But it does nag.
Can you just slip your trousers off and let us have a little look at it and see? Okay, let me have a look at this one too. Oh, right, let me just see. Right, just relax for me. Relax. Okay. Oh, sorry, yeah, we can get that. So.
It tends to hurt
up around here, does it? Yeah. Okay. Up that way?
Up here as well, more.
What painkillers are you taking at the moment?
The last ones they give me, I've taken them, but my wife says it makes me irritable, moody, and it don't agree with me whatsoever.
We gave you some cocodamol, but also some tramadol a while back.
That's right, yeah.
The tramadol can make people a bit sort of strange, a bit funny, a bit irritable.
She said it was making me irritable, nasty and aggressive.
Do you get problems with your stomach or anything?
No.
Okay. It's been a while since you've had your knee x-rayed, so we'll need to get another x-ray and then we can look and see what we need to do. Let's get you some pain relief and then we'll review the whole thing together then, okay?
Thank you very much.
All right?
Thank you very much.
Okay, take care then, and we'll see how you get on. Okay, look after yourself. Bye-bye.
Susan Edwards, please. Hi, Susan. I've got a medical student with me today. Come on in.
She's got a loan.
Thanks for waiting. Dr. Tawana, nice to see you. I think I've seen you guys before, yes. How can I help today?
I keep getting headaches.
Okay.
I've had, is it, I don't know, MRI.
Okay.
This side doesn't really want to open. They admitted me last June because they thought I had a stroke.
Yes.
It turned out they said I had a Horner.
Right. Horner syndrome is where you've got a trio of symptoms. Those include one of your upper eyelids drooping, you have constriction of one of your pupils, and you can also get loss of sweating to one half of the forehead.
It's come back again. I've had a headache now since Sunday.
Yeah.
The weakness has come back.
Right.
I can't. I'm a mess.
So, important questions that I need to check with you. Any fevers, any rashes that have come out of the blue? Any vomiting in the last few days? Good. This headache that you've been experiencing, allowing you to sleep at night? Waking?
Sort of.
Sort of, OK. With Horner syndrome, there can be lots of different causes. To name just a few, you may be thinking of things like multiple sclerosis, tumours in the brain, inflammation of some of the arteries of the brain, herpes, zoster or shingles type infections. My immediate thoughts would be, I think we need to get you seen by the hospital specialist, just because potentially we need to make sure that we're not missing anything.
Really serious accident on a Thursday. I got my legs crushed.
I've got sewing machine on my foot.
Okay.
Stitches.
Oh.
Right, where in your leg?
Had some knee surgery. To my right leg.
My legs both are injured.
Okay.
And then where are you getting the pain? It's just around this top bit.
Got some bruising.
I'm still on crutches.
Yes.
This is the first day I've been off crutches.
Oh, that's good, yeah.
Lovely legs. That was my favourite bit, my legs. That's the worst bit of me. How can I help?
Right, well, first off, it's actually, since I spoke to you, it's gone down, weirdly, but it has a lump.
Okay.
Just underneath there. It was the size of about a 10p piece.
Okay. And did you have bruising over this, apart from this one? Did you have any
it was
other
great,
bruise?
huge black.
Oh, how did it happen?
Well, you see, we left the motorhome site and we forgot to turn the gas off, so she stopped. I got out and I pulled the door shut, and I pulled the door shut right on my leg.
Oh, I see.
Slammed it.
Oh, my.
Yes, it was rather that.
Trauma.
Yes. So the lump was sort of quite big.
How long did it take to swell up?
Well, it sort of did it straight away, practically.
okay.
So,
So that's a hematoma. Yeah. So that's a collection of blood,
Right.
and so it's getting smaller all the time.
Yeah.
Yeah. And it's still there.
Yeah.
But it'll eventually get small. You might have a little nodule left at the end of it,
Yeah.
just as kind of this marks the spot at which you shut the door on your leg. Did you rest it or put ice on it, or what did you do?
Well, no, because we didn't have the sort of ice or anything like that. So I was just sitting in the cab in pain.
Well, any form of ice, even frozen peas or frozen vegetables, go into Tesco. Take the frozen vegetables, but
just sit in the fridge.
Buy them, And
Just a minute.
Yeah.
Don't mind me. I'm just.
Yes, I'm just treating myself. My doctor said I could do this.
I could go into Tesco's.
Yes, no, I'd advise you to buy them first, and then use them.
Okay, that's a good idea. Next time I do something stupid like that. All this typing, you haven't learned to do it with more than one finger, then?
No, sadly. You're pointing out one of my inadequacies.
Well, you obviously haven't got many, you see, so...
I was going to say one of my many inadequacies. Yeah, you got there before I did.
Brilliant.
Nice to see you.
I'm going to just check some of the nerves that come off the brain, just to see how they're functioning. So what we're going to get you to do, focus on my finger, and as I move the finger in closer to you, just keep following the finger. Here we go. Great, OK. Now, keep looking at the finger. I'm going to steady your head. Keep following it, just your eyes now. If at any point you see double, please let me know. Good. 2 up here. OK. Clenching your jaw shut. And then open and clench. Good. Can you hear this? Yep. OK. There is that little bit of weakness around the eye muscles on the right-hand side there. You're seeing double in the corner of that right eye. Are you happy for me to speak to the hospital team? I think we need to get you seen. And it does sound like it could be a Horner syndrome, I think, the Horner syndrome again. Yeah, you had that last year.
Put me in overnight.
OK, fine. Oh, hi, my name's Dr Tawana, GP at Farnham Road Surgery, Slough. I've got a patient, 60-year-old, in the room with me, just a bit concerned about a headache that she's developed. That's lovely. Brilliant. Thank you very much for your help. Cheers. Bye now. OK, so I'll do a kind of a referral letter. They will see you in the ambulatory care department, which I think is next door to the A&E department. So if you go straight there. Today, yes, they'll be expecting you.
I haven't wasted your time by coming.
Not at all. No, definitely not. We need to get you checked out and seen. OK. Good luck up there. You're welcome. You're welcome. Take care.
Good service?
Yes, it's good service.
Kept you waiting, but we got what you needed in the end.
I've been up here, well, this one is nearly 46, 47 years with the Farnham Road.
And today is the best service you've ever had.
Oh, good. Very good. Everybody is nice to talk to. I used to bring them some sweets up here because I worked in that one.
Oh.
Yeah,
We don't need
but-
sweets.
Oh, no, but it was my gesture.
Oh, that's so lovely. Thank you very much.
Thank you very much for it.
You're welcome.
Thank you.
Take care. See you soon.
Mr. Adderby? Roy Adderby? Sorry for the delay. Come on, have a seat. So, it's been a while since we met up.
Yes, yeah.
So, how are things with your back pain and...
Still terrible. Absolutely terrible. Sometimes I don't sleep for a whole night or something, you know?
Main concerns were with respect to your pain relief. And I can see the King Edward's Hospital Pain Clinic invited you for the Living with Pain course.
Yeah, I could only make
2 out of 9 sessions.
Yeah.
Why was that? What happened there?
It's getting there, and you sat there for a couple of hours. I know you have a break, but sometimes the pain just, well...
I would seriously advise you to attend that.
Yeah, well, I got a letter from them saying they will invite me back.
That's right. One of the main concerns from the pharmacist who was reviewing your medication was that you had a slurred speech, and it was also concerned about the tramadol usage. So what do you think about your overall tramadol usage? How much are you taking nowadays?
Well, up to 8 a day. Sometimes if I wake up during the night, or, then I'll take a couple more to try and, help me.
Yeah, 8 is the maximum though.
Yes, yeah.
One would advise, not more than that.
No, I have taken like 10.
I would certainly advise you to cut down on that.
Only very occasionally.
Any other substance that you're using that might cause you slurred speech and confusion at times or anything? Alcohol?
I have a drink now and then, not excessively. I don't do any,
Any other drugs, yeah.
No, not recreational drug taking or nothing like that. Never have done.
You smell of alcohol. Have you been drinking?
Ronald, booth, please. We're upstairs. Is that okay?
Yes, just the nurse.
Come in, take a seat.
Thank you very much.
Come on through. Sorry, it's a bit warm in here. How can I help today?
I still have the pain with the passing of water.
Right.
But it's not as bad.
Okay.
And the tablets run out today.
Right.
And he gave me a 7-day course.
Yes. So how much better is it?
I'm going to the toilet both ends, and my wife's giving me lots of fruit and telling me to drink lots of water, and that's helping as well as the medication.
So you said it was a bit better. Is it, what, 50% better? Or?
About 50, I would say.
Okay, fine. And do you keep needing to go still?
I keep getting the urge.
No blood that you've seen?
No blood, no.
Okay.
But I did, I know I shouldn't do it, but looked at Google.
I did tell you
and I looked at this. I don't know whether that would help.
I have to say, I've never heard of these before. I mean, it does sound very convincing of a urine infection, which is the most common cause of those symptoms.
Yeah.
And the fact that you have had some improvement with the antibiotics would also suggest that it's probably infection, because if it wasn't, I don't think the exactly wouldn't have made any difference.
I did wonder whether it could be stones.
Generally, with stones, you get a lot of kidney pain on one side. And kidney stones wouldn't improve with antibiotics either. So I think, all in all, I'd probably recommend extending the course of antibiotics, because you're almost there, but not quite. So I think probably another week should do it. Drink plenty of fluids as well. If you're still not better by the end of the course, it's probably worthwhile seeing us again. Is that okay? All right.
Thank you very much, Dr.
Yeah, I've had 2 drinks today.
2 drinks, yeah. Do you drink the whole day?
No.
You're on quite a few medications. I wouldn't advise you to binge or take alcohol excessively. How much are you drinking daily basis?
I might have, I've had 2 today.
2 pints of beer, or?
Yeah, beer, yeah. Not strong stuff.
Clearly, that's something we need to keep an eye on.
I am under some pressure at the moment, financially.
Okay.
And stuff, and I'm starting to feel...
That's taking an effect?
Yeah, you know. I have some dark days sometimes, you know. I'm under increasing pressure all the time. You know, trying to sort out where I'll be.
Yeah.
Maybe in 4 or 5 months' time, you know.
Okay.
Whether, I can stay on where I live or whether I've got to go to the council.
Okay.
And beg them for a place, but that's not easy these days, is it?
Yeah.
I mean, no one's going to employ me. I've applied for some jobs in the past. You're lucky today if you get a reply, from a
That's
company.
fine.
So I just feel washed up, wasted. And stuff, and it's really putting pressure on me.
True.
I don't know what to do, really. I just feel like I'm trapped.
Shall I arrange for some talking therapies to help you with?
I probably can do with speaking to someone. I think, it's going to be a help to me.
Fine. Let me arrange that for you. We will keep an eye on the usage of the tramadol, and we will try supporting you with your pain and your mood gets better, okay?
I'm worried about both.
That's right. And I would regularly see you from now on. All the best, sir.
All right, lovely. Thank you ever so much.
Good to see you after a long time.
I'm going to go back home now.
Keep moving.
Yes.
All the best.
Yeah.
Take care.
Okay, Doctor.
Bye-bye.
Bye-bye.
Cheers.
Good afternoon, Final Surgery. It's Ritika again. How may I help you?
We're an appointment to see the nurse Monday morning, please, for a B12 injection.
Let's have a look what we've got.
That was my shoulder. But now my legs are killing me. I'm dragging them about. It's it's breaking my heart. I just can't move.
Colin Carter Senior. If you could just jot it on my card, I'd be happy.
So they just keep giving me back in here, more blood tests, more blood tests. Yeah, that's fine, but we'll do another blood test. We'll do another one.
No, that's fine. There you go.
Thank you kindly.
You're welcome. Hi.
I'm Dr. Sri. Have a seat.
Right. What it is...
I need a written prescription. I've just come out of, from Wexham yesterday. I'll show you, let me show you what the problem is first before I start. I in agony here, I tell you. Oh, we've got all that there,
Okay.
all that there.
Right. When did it come up?
When did it come up? March. I had loads of little bubbles to start off with. And I went to, because I've got leukemia, I've been diagnosed with leukemia since 2006. I was in Oxford for 4 weeks in 2011. I was told I don't have the transplant, I've got about 3 years left. And
Sure.
because in the end I had to have a bone marrow transplant. And everything was all right for about a year and then it come back again.
Has he been quite upset and miserable otherwise, or has he been coping with all this quite well?
Quite well.
Yeah?
He's happy baby.
Yeah, he's quite a happy baby.
Happy,
Yeah, okay.
The thing is, though, he might scream, like, you don't want the ball, and the next minute he's like, and you try and put the ball there, and you push it away.
I do think you're such a happy baby, aren't you? Yes, you are. Okay, well, best of luck.
What's wrong? What's the matter?
Very beautiful now. They get harder work when they get older, don't they? Good luck.
Bye. Come in, have a seat. Hello, I'm Dr. James. Morning, morning. Come and grab a seat. Now, what can we do with Rhoda then?
She got burned. She burned her leg.
And how did she burn her leg?
She pulled the kettle.
Oh, right, okay. Where was the kettle?
The teapot. I mean.
Oh, the teapot. Oh, right. Was it on the sort of table or where was it?
Floor.
On the floor.
Yeah.
Oh, right. Okay.
So I was concerned because of an infection.
Shall we have a look and see then?
Yes.
Yeah. And let you take it off. What's this from? Okay, so they are nasty burns, but they're not infected. And you've sort of done a good job because they are beginning to sort of seal over.
Yeah, because 2 days I opened it and
Yeah.
I left it under.
Yeah. If you've got some Gelinet, it's worth putting a little bit of some Gelinet on again. What we ought to do is just check them again in about 2 weeks to make sure it's all settled down. I think this looks like a little reaction to something. You can see there's some little.
Just now.
You could give her a little bit of Piriton solution, which is an antihistamine.
Antihistamine.
Yeah.
Okay, so.
I'll give you some of that. But I mean, obviously, teapots and stuff, you need to make sure that they're well away because at this age.
I just said to my husband that I'm gonna make another tea.
Yeah.
And I got up and she pulled it.
Yeah. Okay. Obviously, try and keep it out of your way because you're very inquisitive. Is she crawling and stuff at the minute?
Yeah.
What I'll do is I'll just get something just to cover that for you. Sorry, sweetheart. There you go. There we go. You're just put Gelinet on as you've been doing that. Okay. With this, it's just 2.5 mils, half a teaspoonful, up to sort of 3 times a day, just to try and help with that little rash. That's obviously she's reacted to something. Okay.
Thank you very much.
Not at all. Take care then. Bye-bye.
Yes.
Bye. Have a good day, you too. Bye-bye.
Anyway, my back ballooned up, like really big round blisters.
Yeah.
And within those 2 weeks, every time I was trying to get some sleep, my back was popping like bubble wrap. Every time I lie down in bed, I was in a right mess.
Yeah.
Have you ever seen shingles like that before?
This is one of the worst.
That's what they will say.
There's been a secondary reaction on your skin, it looks like.
Anyway, they put me on so much medication and I went back to Whitson yesterday. Yesterday I was given it's a cream.
Yep, capsicum.
Do I just apply this to this?
Did they say not to put it on the shingles bit? I think you can.
I can.
Yeah.
It's going to be iffy.
It is a pain relief cream.
Oh, it is, isn't
yeah,
it?
But it's based on pepper, on chilli. He
warned me about that.
It can burn a bit, but...
It smells... Excuse me. Also, since I read this, I've been coughing up a lot of phlegm, as you can hear.
Yeah.
Is that a chest infection?
I'll have a listen.
Yeah, it's only since I've had this. God, I've been killing out so much muck, is the polite way of putting it.
I'm going to check your temperature. Just put this in your ear. What colour is it when you cough?
Oh, it's just white phlegm sort of thing.
So that's normal for you, that colour, is it? Okay. So it hasn't changed?
No.
But do you think it's more productive, this cough?
Sometimes in the evening watching telly, I have to have an old disused cup by my side in the chair because every time I cough, otherwise I'll be walking back and forth to the bathroom every 2 minutes.
Okay. So, sorry, continue my examination. I'll listen to your chest if that's all right. Some deep breaths for me. If you breathe in and out through your mouth for me.
Fine.
That's great. It's painful when I...
Yeah, it's a nightmare when I have to put a T-shirt on and off.
Okay, fine. Listening to your chest, I mean, good news, oxygen is great. You haven't got a fever. But with the vulnerabilities and the fact that you're on steroids as well now, I think I would agree to cover you with some antibiotics. So that's there to, in a way, to protect you from these sort of situations, from deteriorating. But I will give you something called clarithromycin for chest infection. All right, that's there.
All right, okay then.
All right.
Great.
Okay.
Thank you very much.
Take care. Bye.
Hi, Connor. Come and take a seat.
Thank you.
How can I help, Connor?
Like past week, I haven't been able to sleep at night, like at all, and like my uncle he gave me like he got prescribed some Valium and he gave me one.
Your uncle gave you a Valium?
Yeah, like I had it before, but they gave it for my back, but it helped me sleep before. But it didn't affect, and it's really annoying.
How many tablets did you take?
Just one.
What we say is, because you're very young, you're only 21, we don't want you to become addicted to these tablets. Borrowing other people's medications is something that we don't recommend, because if it's out of date, if it's not for you, you know, you're quite young. And
Nah, he was just trying to help me out.
yeah. So just to double check, have you had insomnia before where you can't sleep?
Nah, this is like the first time.
And in this last 1 week, what do you think might be causing this?
I don't know. Well, I've started a work experience thing where, like, I start at 4 and finish at 10.
What work experience are you doing?
It's warehouse working. So you think that would make you tired? But
Yeah.
I just can't sleep.
And your mood this week, you've not had any recent low mood or previous depression, anything like that?
No, I'm a happy guy.
You're quite happy?
I'm not like, I don't get depressed or nothing like that. No.
And alcohol and smoking, do you do those?
I don't smoke, but I occasionally drink, but that's like when I go out with my friends.
Sure. And do you take any other drugs?
No, I don't take anything.
What I would suggest is, drink lots of water and do something we call sleep hygiene. Get to sleep at the same time every night. Go to bed only when you are tired. Sometimes exercise is good, but not exercising too late in the evening. So with this new job, because it's kind of in the evening, it might have been changed. It's probably changed your kind of routine. Yeah. What we could do is you can try things over the counter, or I can prescribe you something which is very similar to Nitol, called promethazine. It's the least addictive medication to help you sleep, and I can just give you, 4 to 5 tablets just for the next couple of days to help you out. You just take one at night.
Yeah. No,
Would you like to try that?
Yeah, that's fine.
There you go.
Thank you very much.
Okay. Don't take any more tablets, any prescription tablets of other people.
No,
All
don't
right,
worry,
then.
I won't. Hopefully I'll be sleeping properly soon. That's all right.
Take care, bye.
Okay.
Thanks very much.
No problem, you take care, okay?
Thank you.
No, that's for you. Fantastic stuff. You're welcome. Good luck. Okay. Cross your fingers.
Thanks for coming in. Okay, panic over.
No, panic over.
Panic over.
All right. Nice to see you, Mrs. Davitar. All the best. Yeah. Bye.
That's lovely, thank you.
All right.
Ready for a dance now? All right.